Hello, good night everyone. Let me introduce myself. I'm Zara Septika Ladavia from Faculty of Medicine, University of Bengkulu. On this occasion, I will present the journal study by Agustina Boru Gultom, Surita Ginting, and Alni Lorenzi Silai about the influence of lavender aromatherapy on decreasing blood pressure in hypertension patients. Okay, I will share my screen about PowerPoint. Okay, this journal by Agustina Borugul Tom, Surita Ginting, and Elni Lorenzi Silalahi. First, about hypertension and therapy. Hypertension is an abnormal rise in blood pressure occur when the arterioles become constricted, reducing the ability of the blood to flow and making the heart work harder. Hypertension or raised blood pressure is estimated to have caused 9.4 million deaths and 7% of disease burden as measured in DALYS in 2010. In globally, cardiovascular disease account for approximately 70 million deaths a year, nearly one-third of the total. Of this, complications of hypertension account for 9.4 million deaths worldwide every year. Hypertension is responsible for at least 45% of deaths due to heart disease and 51% of deaths due to stroke. People know the hypertension is the silent killer because of sudden deaths due to hypertension. Medication carry inherent risk, therefore both pharmacological and non-pharmacological treatment are warranted. The pharmacological management of hypertension is direct at lowering or controlling blood pressure with the least amount of medication. Non-drug therapies may provide enough antihypertensive effect to lower blood pressure to a safe level without the need for antihypertensive drugs. Non-drug therapies consist of dietary modification like sodium, calcium, potassium, or cholesterol, weight reduction, lifestyle habit change like smoking, alcohol, physical activity, and behavior modification aromatherapy. The location of this research in UPT, Pelayanan Sosial Lanjut Usia in Binjai. This research using pre and post test for collect the data. This activity took 2 weeks with 32 respondents, consisting of 16 female and 16 males. The method in this research first is search the respondent and collect their data. During the process of gathering the data, the research explained the benefit of the research and the procedure of the research to the respondent to be to follow the research procedure and were willing to participate by signaling the informed consent. If they agree to follow the research procedure and fulfill the criteria, fill out their biodata which include their age and sex, which had been prepared by the researchers. 2 is therapy session. In the first period, respondents were given pretest with spike manometer of Nova brand and stethoscope of Littmann brand in order to measure their blood pressure, which will be written in the observation sheets. And they were given lavender oil by using inhalation. By the time the blood pressure was measured, the respondents were asked to sit down comfortably. Their right hands were open and put them on the flat tables, and mercury manometer scale center was put parallel with the research eyes. After their blood pressure was measured, the respondents were given 5 drops of lavender oil. Before that, they were told to exercise for taking deep breaths or inhaling in the count of 5. holding their breath in the count of 5 and exhaling in the count of 5. After they did what had been asked, they were given lavender oil in a piece of cotton which was given close to their nose, around 3 centimeters, and asked to take their breath in 10 minutes. Post-test one then carried out by measuring their blood pressure using manometer, Restanova brand, and stethoscope Littmann brand. The result was written on the observation sheets. This activity took 2 weeks. Three is washing out period, or VOP, is the period of eliminating the effect of the previous intervention. It was done in 3 days. In this period, there was no measurement of blood pressures. The last is therapy session 2. In this period, the respondents were given pre-test and post-test with spike manometer of Restanova brand and stethoscope of Littmann brand to measure blood pressure, in which the result would be written in the observation sheets without giving lavender oil to be inhaled. The interval of measuring blood pressure between pre-test and post-test was 10 minutes. This activity also took 2 weeks. The aspect of measuring blood pressure used a ratio scale. Okay, from the methodology, we have the result. This is the first table, description of the mean value of respondent blood pressure in pre and post lavender aromatherapy intervention. And the second table is mean value of respondent blood pressure in pre and post non-lavender aromatherapy intervention. From this table, we know the difference of using lavender aromatherapy and non-lavender aromatherapy. Paired t-tests had to be used to find out the mean disparity in respondent blood pressure in pre and post-intervention with lavender aromatherapy, and in pre and post non-lavender aromatherapy intervention on condition that the data had to be distributed normally. By using Kolmogorov's Smirnov test, it was found that the disparity of data in the respondent blood pressure in pre and post lavender aromatherapy was given in normal distribution was p-value 0.05 at the significance level of 95%. Therefore, it was appropriate to use paired t-test. This is conclusion. There was the influence of lavender aromatherapy on the decrease in systolic and diastolic blood pressure. From the result of the research, it could be concluded that there was the influence of lavender aromatherapy on the decrease in systolic and diastolic blood pressures. This was in accordance with the opinion which said that lavender was an aromatherapy, one of the types of essential oil which could help decrease cardiac agitation and was effective in decreasing hypertension and palpitation. Lavender is a sedative or giving peace to the heart, decreasing palpitation or sense of inconvenience in the chest, and decreasing blood pressure. The result of research was also supported by Sayor-Wan et al. About the research on the effect of lavender oil inhalation on emotional stress, autonomic nervous system, and brain electrical activity, which showed that lavender oil could cause significant decrease in blood pressures, heartbeats, and skin temperature, which indicated the decrease in the autonomous system. Besides that, the research conducted by Hur and Bay showed that there were the effect of aromatherapy essential oil inhalation on BP, PR, cortical serum in normotensive healthy adults after intensive exposure to white noise, to white noise, and aromatic subtraction stressor by using lavender aromatherapy. Young Lang also showed a significant effect on the decrease in systolic and diastolic blood pressure and doing inhalation within 10 minutes. That is all from me about explanation of journal by Agustina Borugultom, Surita Ginting, and Elni Lorenzi Silalahi. Sorry for all my mistakes. See you in the next time. Have a great day and thank you.